Thinking about raising goats? One of the most exciting and important moments is when a goat gives birth. It can feel a little scary if you've never seen it before, but don't worry, most goats do just fine on their own. In this video, we'll walk you through the entire birth process, step by step, from the first signs of labor to caring for the newborn kids. Whether you're a beginner farmer or just love goats, this guide will help you feel more confident and prepared. Let's get started with what to do before labor begins. Before your goat goes into labor, it's important to be ready. A little preparation can make a big difference. Here are some things you should have in your goat birthing kit. Clean towels, disposable gloves, iodine for the umbilical cord, scissors just in case, a bulb syringe to clear the baby's nose and mouth, a flashlight or headlamp, a notebook to write down birth times and details. Next, make sure the birthing area is clean, dry, and quiet. This helps the mother feel safe and lowers the chance of infection. If you know your goat's due date, start watching closely about a week before. Some goats may even give birth early or late, so keep your eyes open. Being prepared ahead of time means you'll be calm and ready when the big moment arrives. Now that you're prepared, it's time to watch for signs that labor is close. Goats often give little clues when birth is just hours or even minutes away. First, check the udder. It usually gets bigger and tighter as milk comes in. You may also notice the area around the tail feels soft or sunken. That means the ligaments are relaxing. Some goats like to be alone before giving birth. If your goat starts separating herself from the rest, don't worry, that's normal. Other signs include pawing at the ground, getting up and down, or making a little nest. These are all part of getting ready. You might also see string of mucus. This shows that the birth canal is starting to open. Some goats become more vocal or breathe heavier. These are signs that labor is starting. Once you see these signs, keep a close watch. The first stage of labor is about to begin. Stage 1 of labor is called early labor. This is when your goat's body is getting ready to deliver, but no kids have arrived yet. During early labor, the goat may act restless. She might lie down, get back up, paw at the ground, or look back at her belly. She may also breathe heavily or grind her teeth. Don't be alarmed, it's all part of the process. Inside, her cervix is slowly opening, and the kid is getting into position. This stage can last anywhere from a couple of hours to most of the day. Let her be. Just keep watching quietly. As long as she seems okay and is not in distress, there's no need to interfere. When contractions become stronger and more regular, she's moving into the next stage, active labor and delivery. Stage 2 is active labor. This is when things start moving quickly. You'll see strong, steady contractions, and the birth is just minutes away. First, a clear, fluid-filled sac, called the water bag, may appear. This is a good sign that delivery is starting. Your goat will push and strain. Don't worry, this is normal. She may take short breaks between contractions. Watch closely for the kid's front hooves and nose. This is the best position, like a little diver. With a few strong pushes, the kid should slide out. The mother will usually stand up and begin licking the baby right away. This helps clean and warm the newborn. If your goat is having more than one kid, she'll usually rest for a few minutes, then start pushing again. Each baby should arrive within 30 to 45 minutes. Most goat births go smoothly. Just be patient and give her space unless something seems wrong. After the kids are born, there's still one more step, delivering the afterbirth. Once all the kids are born, your goat enters the third and final stage of labor, delivering the afterbirth. also called the placenta. This usually happens within 1 to 3 hours after the last kid is born. The placenta may come out in one big piece or in sections. You don't need to pull it out, just let it come naturally. Pulling can cause injury or infection. Some goats may eat the placenta. While it might seem strange, it's totally normal. It gives them nutrients and helps clean up the birthing area. If your goat doesn't eat it, just remove it and throw it away to keep the area clean. If the placenta hasn't come out after 4 to 6 hours, or if your goat seems tired or sick, call a vet for help. Now that the birth is complete, it's time to care for the newborns. Right after birth, the most important thing is helping the newborn kids breathe, get warm, and start nursing. If the mother doesn't clean the baby right away, you can step in. Gently wipe the nose and mouth to clear any mucus so the kid can breathe easily. Use a clean towel to dry them off, especially if it's cold outside. Newborns can chill fast, and staying warm is key. Next, dip the end of the umbilical cord in iodine. This helps prevent infection where the cord was attached. Within 30 to 60 minutes, the kids should stand up and look for milk. This first milk is called colostrum, and it's full of nutrients and antibodies. Make sure each kid finds the teat and starts nursing. If they're having trouble, you can gently guide them or milk the mother a little into a bottle. Once they've nursed and are warm, most kids will settle down and nap. That's a great sign. Everything is going well. Now let's check in on the mother and make sure she's recovering too. After giving birth, your mother goat needs some extra care to recover and stay healthy. Offer her fresh water and some electrolytes or molasses to help her regain energy. Check if she has more kids inside by gently feeling her belly. Sometimes twins or triplets come one after another. Keep an eye on her for signs of infection or weakness, like heavy breathing, unusual discharge, or not eating. Keep the birthing area clean and dry to help prevent illness. With good care, your goat will bounce back quickly and be ready to care for her kids. Sometimes, things don't go as planned. It's important to know when to call a vet for help. Call a vet if your goat has strong contractions for more than 30 to 45 minutes without delivering a kid. You see a kid stuck or coming out in the wrong position. The mother looks weak, dizzy, or very tired. There's a bad smell or unusual discharge. The placenta hasn't passed after 4 to 6 hours. Don't wait too long. Getting help early can save the lives of both the mother and the kids. Watching a goat give birth is an amazing experience. Remember the key steps. Be prepared, watch for signs of labor, and step in only when needed. Keep calm, provide a clean and quiet space, and care for both mom and her newborn kids. If you found this video helpful, please give it a thumbs up and subscribe for more tips on raising healthy goats. Thanks for watching.